We're live.
All right.
All right. Hey, everybody. Welcome to our live tonight. Welcome to a discussion on COVID, mental health, and children. My name is Hope Harmon. Thank you so much for joining Act for Change with Hope Harmon tonight. I'm a change agent, an elected official in Ben Hill County, and an advocate for everything that is right. Living in rural South Georgia. So, through open and honest conversation, my goal is to help change mindsets, perceptions, and call people to action through these great discussions. So, I want to introduce MJ Larkin. She is the owner of Faith Works Coaching and Counseling LLC. Be sure to follow her on Facebook. She is a mental health professional and coach, and she offers several different services, workshops, and classes. Also, follow her on Instagram at the Single Mommy Therapist. Is that correct?
Yes, that is
Okay.
correct.
Make sure you go follow her on Instagram as well. So the inspiration for this live is I got to thinking, with everything that we've been going through in this pandemic, and we've seen so many things of mental health, we haven't seen a whole lot of conversations surrounding children and mental health. And I think that sometimes children are kind of forgotten in the shuffle about when so much is going on. And I think it's really important that we have conversations with children about their mental health, that we take note and understand that children do have mental health. Mental health just doesn't develop when you're an adult. So we just I'm gonna ask MJ some questions. We're gonna have a good discussion tonight. And if you have any questions or comments, just please drop them in the comment section, and if we have time to answer them, we will. If not, I'll make a follow-up post answering any questions, or please feel free to inbox me. So we're going to start with, what is mental health and how can we ensure that children are mentally healthy?
All right. Mental health is a condition which entails someone's psychological and emotional well being. With children, however, it looks very different than it would with adults, because a lot of times kids do not feel comfortable talking, and adults, don't feel comfortable talking sometimes, but also you'll see children act out in different ways. So it's really hard unless you have been trained, or unless you are someone who is just very adamant about children's health overall.
Mm-hmm.
It's really hard to pinpoint certain things when it comes to the mental health of your child or children.
Okay, so what have you seen in the field? Because MJ works with children. So what have you seen in the field are the effects of the pandemic on children and youth thus far?
Man, we could be here all night. So I have personally seen children become more isolated. I've seen a rise in anxiety. I shared with you earlier. I heard about a child who had anxiety-induced paralysis. So for those of you who may not be familiar with the term paralysis, it just means you're not able to use your limbs. And went to a specialist and everything, and could find nothing. And it was just determined that it was stress induced. I've seen a lot of children feel like they can't talk to their parents because, mom or dad may be unemployed now. And so they feel like, okay, I can't put this pressure of me on my parents. So I've seen a lot of kids in a sense become the adult. So they're more concerned about, is my mom okay? Is my dad okay? I've seen kids who never had to worry about how they were going to eat, or where they're going to get clothes or anything from, and now all of those things are really inducing anxiety and stress, and depression as well. And it's just been a lot. And a lot of times kids are easy to look over, especially as an adult. You're going through your own things, and sometimes you don't mean to, but
Right,
sometimes it's the assumption, like we talk about all the time, that our kids are just good. And
right,
so as long as we don't tell or show, then they're okay. But kids know.
right.
So yeah.
I mean, kids are way more like intuitive than we think they are. Like they
Yes.
know,
Yes.
like they know stuff is going on even if they don't say it.
Mhm.
So, What I know you mentioned about the isolation. So what are the what effect does isolation have on anybody's mental health?
Well, the biggest thing is developing social anxiety.
Mm,
So you might be someone who is used to being out in crowds, or you've always been outgoing. You hear some people use the term extrovert.
yeah.
So you're super extrovert. You're always out and doing things. You might be in the community. You might be with friends or family. But now COVID has forced us all into some form of isolation, right? And
Yeah.
so the biggest thing again is social anxiety. We've also seen a spike in depression. We've also seen a spike in suicidal ideation because, again, people are feeling alone. And so if you're not reaching out and you're not telling your friends, like, hey, I don't feel like myself, right? Or since we're talking about children, kids don't know how to tell you, like, hey, I know something's not right,
Right.
but I can't, put a term or anything to it. And a lot of them aren't on Google looking up things, right? And so, again, like I mentioned, we're seeing a lot of spikes in anxiety and depression. So that's the important part about, being alone in this pandemic. You don't have to feel alone. There are so many hotlines now. There's even a hotline, a text line that you can just talk. You can just text. Literally,
Wow.
this all you do. You just text the person. You're letting them know, like, hey, I feel like this, and then they just, I don't know the time frame of it, but you're able to just sit and talk to someone. There are
Wow.
a lot of resources out there. We just have to take advantage of them.
That's really good to know, especially with that text. So, because so many kids are into text, and I'm sure
Yeah.
that will be a really comfortable thing for them to do. I know you
Yes.
mentioned about the spikes in depression. So, what are some signs of depression that parents should look for?
With children, the biggest thing you want to look for is a change in routine and behavior.
Hmm.
You want to look for your child becoming more isolated. Those are the two biggest things when it comes to children. Now, if we're talking about maybe like teens or adolescents, some parents may say, oh, they're just going through, puberty and,
Yeah.
hormones are up and down. Well, that may be the case. If you start to notice your child become more withdrawn from the family, doesn't want to do anything with the family, doesn't want to do anything with his or her friends, check in with them. um Again, like I mentioned earlier, it's easy to brush certain things off, right? So if
Right.
you notice that your child is in their phone a lot more, and that's another thing too, be sure to check their phones. I know that's probably going to rub some people the wrong way. However, there's a fine line between being an investigator and just checking up to make sure that they're not engaging on any sites and any behavior. Like you and I always talk about, parents do have the biggest influence over our children, but what are we doing with it? So if I'm always on my phone, I can't not expect my child to be on her phone too, right?
Right. Right.
Um, so again, but those are the two biggest things, is becoming more withdrawn and, like I said, isolating. And then the biggest thing is the change in behavior. Um, it's really important just to check in. I get it. It can be hard because they do give you those
Right.
one-word questions. I mean, one-word answers.
Yeah.
There are ways to ask questions to know what you want to know.
Gotcha. So I know like sometimes, with I know down here, kids are back in school, like face to face learning. So I know sometimes parents would kind of think that, oh well, they have the counselor at school, so that's enough. So can you just kind of explain to parents like the difference between like the school counselor and a mental health professional?
Yeah, it is just what you said it is. School counselors deal primarily with data. So they're going to be dealing with kids with SAT scores, PSAT scores, anything that has to do with numbers, right? They do sometimes lead groups, but sometimes it's more academic driven because school counselors have multiple roles.
Right.
They do everything aside from being a school counselor. And it's not that they're choosing not to. But sometimes, depending on the district you're in, sometimes you can be shorthanded. And so they're all over the place, right? There are some awesome school counselors. However, there's a difference in a mental health counselor and a school counselor. Now, a school counselor can refer you to a mental health agency. So with mental health, we do more of the processing. We do more talk therapy versus a school counselor, can sit down and have a conversation, but they're going to refer out.
Right.
Because that's not, all that they do. Now,
Right.
with that being said, there are so many school counselors who also have the LPC licensure as well. So sometimes I haven't seen too many act in a dual role because, again, the district will bring in someone, usually they'll outsource somebody from an agency to come in and do sessions. Like the company I work for, we're all around in the metro area, right? But again, school counselors are going to do more referring out. Now, your child can go and talk to a school counselor and let the school counselor know, like, hey, I'm having this issue at home. I don't feel like myself, or my parents are going through. So then school counselors are able to do like linking, which is just like, hooking people up with the proper resources, which includes a mental health therapist as well. So they don't get a lot of time. And that's another thing too. School therapists don't get as much time with the kids sometimes as much as a mental health therapist would. So again,
Right.
the biggest difference is more on the processing side of things. And we do more talk therapy than just gathering information to like refer out.
Right. And I think like here we have maybe like one school counselor per school and maybe like two at the high school, which of course they're leading them into what they're going to do after graduation. So I think it's really important for parents to know that the school counselor may want to be that person that your child can talk to, but they're seeing
Right.
500-600 kids to one person. And
Right.
so you can seek this mental health professional that really focuses in on your child, well, you and your child,
Right.
because they will definitely give you tips and tools that you can use at home as well. So at what point do you think a parent should seek a mental health professional for their child?
As soon as you notice a change in behavior.
Mm.
Sometimes you do have to go with your gut on things. And so even if you're constantly asking your child, hey, how was your day? Are you experiencing any bullying? Are you being stressed because, now you went from in person to now you're doing full on virtual? And also, there doesn't have to be anything particularly major like a diagnosis per se, but just providing that space, allowing your child to have their own space outside of you. I think that's the biggest thing. So again, just learning how to just have that conversation. And if you have that gut feeling, please reach out. You can always reach out to your PCP and they can refer you out to someone. Normally, they're very good about being paired with partnering with agencies that are
Right.
local in the community. And even if they're not local, they're still within a decent, driving time. So you're not going to have to come way to Atlanta or go
Right.
hours down south either, So they're pretty good about partnering with those who are local, even though they're not, in town.
And with the great technology of the telemedicine now, you're pretty much in the
Yes.
comfort of your own home, and you just have to give them a safe space where they can talk to their counselor by themselves,
Yes.
parents. By themselves. Do not. I mean, I just want to insert this in here. Like,
You took it right out of my mouth.
insert this in here, parents. Like,
Yes.
do not. It's important for you to have a relationship with your child's mental health with their counselor, but do not insert yourself into those sessions. If that counselor asks you to leave or asks you for a safe space to be able to talk to your child, it is really important because it's important that your child builds a trust with their counselor so they can share many things with them. And I think, I also want to add that If the counselor comes back to you and says your child said such and such, do not get offended. They are simply trying to help you and your child, because you just never know what
Right.
difference that counseling is making in the life of that child.
Mm-hmm.
So just don't be offended. Nobody's saying that you're a bad parent because your child has to have counseling and things like
Right.
that. I mean, I go to counseling. I'm a big. Everybody knows I'm a
And I
proponent
do
of
too.
counseling. So,
If your therapist doesn't have a therapist, run.
exactly. So I just had to like
Run.
insert that
It's
in
a
there.
lot. Yeah, it's a lot. Oh, and
Okay.
I also want to plug those who are watching who have some form of like Medicaid, whether it be WellCare, AmeriGroup, I know Peach State.
Mm-hmm.
Your child can be seen by an agency, telehealth. This pandemic has caused the CMOs to be they're lenient on telehealth right now. We don't know how long this is going to last. So I want to encourage those. Again, like I mentioned earlier, there are a lot of resources out there, but you have to start searching. And the best place to start is with your child's PCP. They can always direct you because they're definitely going to have directories for agencies who do take Medicaid now. And they have some really, really good therapists too. And like you mentioned, they do the telemental health screenings. I said it backwards, the telemental health sessions, and then telehealth screenings as well. So you never even have to leave your home. Also, what the state has also done, you don't have to necessarily live in the county to receive services. You just have to be within a radius. So I just wanted to give that plug to those because, I'm from Fitzgerald too, and I know sometimes rural South Georgia gets left out.
Yes.
However, we do have resources too. But again, for those who do have AmeriGroup, WellCare, Peach State, you are not left out of this conversation at all. So please, please, please take advantage if you know that your child does, or if you would like for your child to have that outlet, if they don't have a mentor, but you can kind of notice a change, or maybe they're not, or maybe you're not comfortable with talking to your child about certain things, right? Please, please, please reach out to your PCP and get that directory, and please start services as soon as you can. That way your child does have an outlet.
And I'm really glad you made that point about Medicaid, Peach State, WellCare, because I think sometimes that people think that counseling and mental health services are just so expensive and they are beyond the
Right.
scope of what they can afford. But these things are paid for by these good state tax dollars,
Mm-hmm.
and federal dollars, and we definitely need to take advantage of them.
Right.
So get with your primary care physician, your child's pediatrician, and see what is available. And if you have to, call WellCare, call Peach State, call them
Yes.
and ask them, hey, I live in Fitzgerald. This is what is my service area. I'm looking for this a counselor for my child. And then you can always go to your doctor and say, this is who I want my child to see, and just
Right.
get them to do the referral. So, I mean, there are so
Mm-hmm.
many ways that these services can be paid for. Just in the comforts of your home. Now you don't have to
Right.
go to the vet office. You can be home. So I think you did cover about who they should speak to, which is their primary care physician. So we're gonna talk a little bit about what you have seen as far as suicide rates, because I think that while suicide is not something that people like to talk about, it's very real. And that I think it is a discussion that we simply have to have. So I want you to talk a little bit about suicide rates, and also what are some of the signs that parents can look for regarding suicide.
So we don't have exact numbers just yet, but from the reports that are coming in to different agencies, we're seeing an influx in patients who do have suicide ideations. We've also seen an influx of patients who have attempted suicide multiple times. So the number is definitely on the rise. It's even more so in a rise right now with our Black boys. I think it was between ages 10 and 13.
Wow.
Um, So yeah, I mean, our children are stressed. And the thing is that it's hard to recognize certain signs, right? And most people, most parents, when you hear like, oh, my child is cutting or burning their skin or picking their hair, to where now they have bald spots and everything, or picking at their skin. Most parents are frightened by that, right? And so sometimes, I get it. As a parent, you don't want to think that your child is engaging in these type of behaviors. However, you don't help your child by having a knee-jerk reaction. And I get it. You're their parent. You want to make sure they're safe. You want to make sure that nobody's bothering them and that they're okay. But a lot of times, that's the way that kids release. They release that anger, that stress, or that
Mhm.
anxiety by cutting or engaging in some sort of self-harming behavior. Now, self-harming behavior and suicide are two different things. You can cut and not want to slit your wrist or kill yourself. You can burn your skin and not want to kill yourself. You're not doing it for that. Normally, when you see kids engage in that kind of behavior, it's something going on internally, right? So maybe there was some sort of sexual abuse or physical abuse, or they're being bullied and they don't know how to communicate that. So they turn it back inward and they do something that they can control, like cutting, picking their hair. You might notice a drastic change in their clothing. But as far as identifying certain signs, talk and be straight up and just ask. A lot of people believe is that if you ask something that they're going to do it, right? That's
Right.
not the case. That's not true. And there are reports that don't support that myth. So that's no. If it was already on their mind, then you asking them about it, it's not going to push them to do something that they weren't already thinking about doing. But again, if you suspect that there have been some drastic changes, again with clothing, hair is usually something to look for. Clothing, if they're starting to wear longer sleeves, like in the summertime, or if they're starting to kind of get shy, like if even wearing short sleeves or something like that, or even just a regular top. Those are some behaviors and things to just say, hey, why are it's hot.
Right.
You don't want to change. Instead of saying, hey, why are you wearing that? Prompting them to really be able to have a conversation with you. But the biggest thing is that if you suspect a change in behavior, another thing you can do too, check in with your kids' teachers, check in with your children's friends. Those are the people aside from you that spend the most time with your kids as well. I mean, think about it. You're in school, what, 8 hours a day?
Yeah.
Or if you're someone that's always with your friends, I mean, you're with your friends the majority of the time too. So have that conversation with their teachers, like check in if they've noticed some behaviors going on, or if, they've seen incidents of your child being bullied or your child doing the bullying, or if you notice the grades starting to slip. Again, just check in. There's no real way to know anything except to ask and be proactive, and just have a straight up conversation. And there are parent support groups too on social media
Yes.
that encourage parent communication. A lot of times we think it's easy just to not talk, right? Or when I'm not going to say that or question that. But that's not always the case. You got to remember, we have the biggest influence over our children, regardless of social media, or friends or anything like that. But again, like I said earlier, what are you doing with it?
I totally agree. And I also wanted to add that if your child tells you that they are thinking about killing themselves or committing suicide, take them seriously. Do
Right.
not brush it off. Do not say, oh, well, they're just talking. No, take them seriously and take
Right.
them at their word. You know your child, but please take them seriously. Please, please, please listen. And we're gonna have a whole nother live about communication. Like about communicating with these teenagers, boys. I tell you, getting beyond that surface level is hard
Ooh,
sometimes.
listen.
I think sometimes Trent go too deep, and I'm just like, get out.
Yeah, and that's the thing. And and like we always talk about all the time, you can only go as deep as your comfort level.
Yes.
So if you're not comfortable talking about things like sex, suicide, depression, friends, anything, they're going to know that. And not only will you feel awkward, they'll feel awkward as well, just even talking to you about it. So again, it's just, we're not perfect and they're not perfect either. But
Right.
you can't see any progress if you don't start.
I agree. I
Another thing.
totally agree. So how can we as parents advocate for our child's mental health?
Ooh, speak up, ask questions, research, read. If your child's pediatrician comes back and gives you a diagnosis of depression, anxiety, ADHD, ADD, autism, you have the right as your child's parent to seek however many opinions you want to. You also have the right to get a referral to a specialist, regardless of your insurance type. You
Yes.
have that right as the parent. Excuse me, you have that right as the parent. So if nothing else, speak up, ask questions. I know, I get it. A lot of times sitting across from a professional can be very intimidating, right? Because we assume that, oh, they went to school for this, they've been practicing really, a really long time, that they know. However, you have one up on them. You know your child. And it's okay to receive whatever diagnosis, but it's also okay to advocate and say, can I have a referral to a specialist? Someone who, maybe if we're talking about mental health, you want to refer to a psychiatrist or a psychologist.
Yeah.
And even if you go over there and you're like, okay, I want to talk to a mental health therapist, because that's mostly talk therapy. However, we can diagnose, we just cannot prescribe medication. But if that's the route that you want to take, you can do that. So another thing too, please be open and receptive. I get it. It's hard receiving a diagnosis as an adult. It's even harder not to internalize when you hear something about your child and not feel like, oh no, what did I do? How did I miss this? Don't beat yourself up. A lot of things, especially like mental health disorders, an onset doesn't happen until I think like 7 with some disorders, and even later. There are some disorders you don't develop until 16, 18, and even sometimes, such as anxiety, you can develop that as an adult. So you can't beat yourself up about things you didn't know. There was nothing you could do to prevent it. If it happened, okay, you can be overwhelmed. You can see somebody yourself. Seek out support groups for parents, of children who have that particular diagnosis: schizophrenia, bipolar disorder, depression, anxiety. I mean, there are a plethora of groups on social media that are led by parents that, offer some sort of support. But don't be afraid to speak up. If you're not happy with, them saying your child needs medication, okay, get that referral, go get another opinion,
Yeah.
go from there.
Yeah, right.
And not be afraid to speak up. And I get it, like I mentioned earlier, it can be intimidating, but you have to remember, you're advocating for your child, not trying to prove whether someone is right or wrong or not. You just want to make sure that, the goal is your child's well-being.
That exactly. I also wanted to add that parents, when you get that diagnosis, you need to share that with the school. Do not keep that to yourself, because if the teacher doesn't know that your child is autistic, because there are many high functioning autistic children, or if the teacher doesn't know that your child is diagnosed with bipolar disorder, not you just, someone just saying, oh, they must be bipolar. No,
Right.
if they know these are actual diagnoses that come from, psychologists, in
Right.
these groups, there are things they can help you with on the school level as well to ensure they succeed academically. So
Mm-hmm.
do not be ashamed to share that information with the school. In fact, please do, because they really need to know
Exactly.
that. And not just the counselors need to know, their teachers need to know as well. Because once again, counselors are dealing with 500-600 students. So when you have that parent teacher conference, make sure you mention that to them. Hey, I've turned in this evaluation to the school system. I think y'all need to know that this is what my child is dealing with. And I'm telling you, that can change. a lot of things for your
Yes,
child to mimic.
yes.
So I think you answered some of my other questions too with that. So I think we're gonna go to like, how can parents create a safe space where their child is comfortable talking about their mental health, or really just talking in general?
You definitely want to just start with general conversation.
Right.
It is very easy to feel like you are investigating your child, investigating about their day. It can feel like you're pulling teeth. Because again, you got to remember, we're just asking questions. How was your day? Good. Did you do anything? No. Um,
Like,
who's your favorite teacher? I don't know. So
which one? Who
don't
knows?
get so my number one thing is don't get frustrated in the conversation. Again, you want to keep building that rapport and that trust, and that's the biggest thing. That's one of the human needs too, is trust, and it's security. That's tied to security. So you want your kids to know, like, I'm your parent, but I also care about you. I'm
Right.
not just someone who buys you nice things or takes you places. I care about you and I care about your well being. And a lot of times they mistake our yelling, jumping around, and screaming as being mean. And I get it.
Yeah.
But I think it's important, again, to know how to apologize to your kid. I think it's important to know how to admit when you aren't right, or when you overreacted. I think it's appropriate to have a conversation to let them know, this is why I did XYZ, right? I want the best for you, instead of saying, I did that because you made me do that. No, because then they internalize that.
Yes.
And what they start to do is just enough to keep you off their back. Now, that doesn't help you at all, because then what could happen is that they just start to shut down. So, they become more worried about you instead of you even, worrying about them. So, again, just being more comfortable, being patient. If nothing teaches you patience like raising children. Um,
Yeah.
and it's
Right.
a continual thing. It's a continual thing. It's not just a one size fits all. So, no comparison of your kids to anybody else. Everybody is different, and you should appreciate about their child and encourage that, and let them know, like, that's their own superpower and that you support that. But overall, as far as creating the space, you just want to keep building trust. And again, if they share things with you, please don't get on the phone and tell your friends. Please don't send a text message, because that's definitely the quickest way to get them to be quiet. Because the first time you say, well, you didn't tell me XYZ, I'm like, well, you told my auntie, and I heard you telling grandma. And so that's the quickest way to get them to shut down. So if your child shares something intimate with you, please be mindful. And if you are going to share with a friend, let it be for support purposes. Let it be, if your friends have older children, let it be for support purposes. Like, hey, I know you have older children. Did your kids experience this? And that way you feel supported, and your kid doesn't feel like you just told out their business.
Yeah.
So again, you just want to be comfortable with having conversation, be patient, really be engaged with them. And I get it. With this pandemic, all of us are really going through it, but we always are better together. So, don't feel alone. We None of us are perfect. We're
Oh,
all still learning. No child is the same. No matter how many children you have, no child is the same. And you want to change that. You want to adapt that mindset that, okay, this is a different child. So maybe what I did with my oldest doesn't work for my youngest or my middle child. So yeah, just being comfortable and learning to be patient, and don't ask investigative questions. So give them a chance to answer sometimes. You'd be surprised they'll actually come to you with some stuff.
that's that's very true. Like a conversation or two of openness, and then the next thing you know, you're like their bestie, and they're
Right.
telling you everything.
Literally,
Like
literally.
things you're not even ready for. Well,
Tell me about it.
well, thank you so much for joining us tonight for this discussion. Thank you for your time, MJ. So, everybody, make sure you follow MJ at Fake Forks Coaching and Counseling LLC. on Facebook. Make sure you follow her on Instagram at the Single Mommy Therapist. Be sure to follow my advocacy page, Kasera's Voice, as we continue to seek justice for Kasera and Aviana and others who have lost their life to violent crimes. Make sure you subscribe to the podcast, share the video, come through on YouTube. And we'll be hosting another one. We'll be having another one of these good discussions soon. So just be on the lookout on Facebook and everywhere else. Thank y'all so much for joining us tonight. Have a great night.
Bye, everybody.